The Ora-Light Oral Motor Exercise System is an exciting new therapy tool that targets and maximizes rehabilitation outcomes for patients with oral motor deficits. The Ora-Light Oral Motor Exercise System is ideal for patients with weak or dysfunctional oral muscles that limit their ability to effectively speak, swallow, or chew. The goal of the Ora-Light Oral Motor Exercise System is to strengthen the musculature of the tongue, lips, and cheeks, and facilitate neuromuscular coordination and competency for speech and swallowing. The Ora-Light Oral Motor Exercise tools have activating shapes and textures to provide increased sensory feedback. This sensory feedback contributes to the initiation and timing of patterned oral motor activity. The Ora-Light Oral Motor Exercise System can be utilized in both a clinical therapy session and in a patient's home. Exercise therapy in a patient's home can cut costs and save time for both the patient and the therapist. The additional repetitions of correct muscle movement patterns will expedite improvements in the patient's speech and swallowing. The goal is to provide as much repetition of the correct muscle movement pattern as possible to achieve automatic execution of the skilled task. An educational exercise protocol is used with each of the 4 exercise tools. This enables the patient to carry out consistent and repetitive exercises to strengthen the muscles of the lips, cheeks, tongue, and to facilitate neuromuscular competence. A baseline and suggested training exercise protocols are illustrated in the instruction manual. The purpose of this program is to feature baseline exercise protocols for each of the Ora-Light tools. The baseline exercise protocol for the child-size Ora-Light Oral Motor Exercise System are identical to the ones featured in this program. The Ora-Light Oral Motor Exercise System can be utilized in children's therapy for functional articulation disorders, swallowing, and tongue thrusting therapy. The exercise protocol consists of 5 parts. 1. Assisted movement exercise. 2. Isometric exercise. 3. Isotonic strengthening exercise. 4. Precision and accuracy of articulated sounds and neuromuscular control exercise. 5. Swallowing exercise. The baseline exercise protocols enable therapists to establish a level of muscle strength and endurance at the start of training. The baseline exercise protocols also allow the therapist to measure progress during and at the conclusion of therapy. Patients who experience this therapy become highly motivated to succeed in rehabilitations as a result of positive feedback that is provided by improvement in functional competence. Tool number 1 has 2 functions. One is to strengthen the lip and cheek muscles. The second function is to retrain tongue thrusting. Tool number 1 will help guide patients to position their tongue tip on the palate behind the front teeth, instead of thrusting their tongue between the lips and out of the mouth. Tool number 1 has a football shape on the handle with a textured surface. Also note the hole opening on tool number 1. This helps the patient feel where the tongue tip should be placed, guiding the patient to position the tongue tip on the palate behind the front teeth when speaking and swallowing. Muscles exercised include orbicularis oris, mentalis, levator labii superioris, and buccinator. The goal of exercise protocol 1 is to strengthen lip closure. Place tool number 1 on the palate behind the front teeth. The therapist will assist the patient to close lips around the football shape, using thumb and finger to assist the movement. This allows the patient to get a tactile feel of lips against the football shape. The goal of exercise protocol 2 is lip strengthening. Place tool number 1 on the palate behind the front teeth. Elevate the tongue tip in the hole opening. Close lips around the football shape. Maintain tongue tip elevation until the patient experiences fatigue. Record time of tongue tip elevation in the number of seconds. The goal of exercise protocol 3 is to increase range and ease of movement. Place tool number 1 on the palate behind the front teeth. Open and close the lips around the football shape as many times as possible. Record number of closures until fatigue. The goal of exercise protocol 4 is precision of movement. Place tool number 1 on the palate behind the front teeth. Repeat the following sounds with the lips closing around the football shape every time a p sound is made. Repeat sounds.
Pa, pa, pe, poo, ip, ip, oop.
Repeat sounds. P, 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 p. Record the number of p, p sounds articulated in 10 seconds.